Medical Center, and I don't know what it means to you and the community.
I guess the best way to say is we're still on target, according to Mortensen Construction, to complete the building in June. We will then create punch lists, with the architect and other individuals who work for the hospital, and they will then fix that. During that time period, we'll begin intensive training for the employees in wayfinding, where's the laboratory, where's the ER, where's the restroom, where's my office, how to use the new telephone systems on the place. And in the more technical areas like radiology, we've got new equipment coming in there. Those folks will begin to use that equipment. The old equipment will stay here. In nursing, we have centralized fetal monitoring station. For the infants, we'll be able to send the heart strips of the babies to be born to the doctor's offices. We've got a great nurse call system that will give the nurses more mobility and not have to run back to the desk. We'll also enhance patient safety by patients being able to reach their nurse, or if their nurse isn't available, the next person will be called automatically. The entire hospital was built with the idea of reducing infections, everything from having individual showers and bathrooms in each room to having different surfaces that don't allow bacteria to grow as easily. New beds that are certainly more flexible, have the ability to have storage right in the bed, so everything that's important to you can keep right by you. Just having a more up-to-date appearance with the atrium where visitors and the employees can go to relax, that you'll forget you're in the hospital when you're out there, having a cup of coffee or having a meal. So that's what we're up to as far as the construction goes. A new physician recruiter who's had a great deal of success in the northwest part of the state in bringing specialists in. He just joined us probably about 6 weeks ago, and so we're very hopeful that something will come from that. The new hospital, we've noticed, has attracted more inquiries from professionals, not just physicians, but other folks who are, maybe might give us a second look. So that is really a major. To sum it up, we're working on the move to the new hospital and also recruiting new physicians. When our physician recruiter was out here, he met with members of the medical staff, and the list includes orthopedic surgeon, neurology, which surprised me a little bit, and so we've got that in there, OBGYN, and cancer care. And that will require creating a relationship with a larger entity, because if you want to do any type of tomotherapy, which is a form of radiation therapy, you do need to have a radiologist, oncologist available when the patients are here. So we need to work with a larger organization.
Thank you. Marty, what is going to happen? What's going to happen in the week prior to actually moving patients into the hospital during that grand opening week?
Okay. Actually, it's not just a week, it's several weeks prior to that. We'll be stocking the new hospital with supplies. You can't remove the supplies you have from the current hospital because you still have patients coming. we'll have a mobile CT available because we'll be moving our current CT, which is about a year and a half old, to the new hospital. We will, during the prior weeks, be putting patient beds in the rooms. The electronics will be tested, the nurse call system, as well as the telephone system for the whole hospital. The elevators will be tested. Basically, what you want to do before the move is stress your electronics and your mechanical systems, like elevators, to see if you can cause them to fail, so that you can fix the problem before you get there. I'm not saying you can't have a problem once you're there, but you want to stress these systems. Our folks in nutritional services not only will be stocking to the area, but they'll be familiarizing themselves with how that works, both for patient service delivery, as well as ensuring that we have meals for visitors and employees. And that will go through the whole building. The computer system is kind of interesting because we'll actually have a duplicate computer system out there before we move, because we were planning on an upgrade. So by doing that, we can actually begin to test what's out there, make sure we can communicate with the outside world, both with emails, billing, and every other related situation. Making sure we know where to park, making sure we know how to find a way into the building. There's a employee lot on a lower level that has its own door. Making sure our ID system, which will be all electronic, you'll have swipe cards, there won't be a number anymore. You'll need to have that to get in. It works properly so we don't lock people out. And making sure the building's secure and ready to go.
Before the patients actually move into the hospital, we'll have what would be called a grand opening, and we'll have some government people here. Hopefully we'll have a senator or two, House representatives, perhaps governor, mayor, etc. Everybody people from the USDA will be there, and have tours for the public, over that maybe a 3 or 4 day period, and we'll have schedules for that as we get closer to it. But that grand opening day is a pretty exciting event for all of us, because of all the help and support that we receive from not only the community but from the state and federal government. And then after that's over, then we take a deep breath and make the transition of actually moving patients from the old hospital into the new hospital. And Marty, what's that going to be like?
Very carefully planned. The key part is, which has always been my concern in other moves, is making sure the public understands where and when they're supposed to go to the new hospital. That involves coordinating with the Department of Transportation and changing hospital signs. I'm sure we'll have some level of care available at the current hospital if somebody comes to the wrong place for a short period of time. But by and large, we need to make sure we're getting the patients out to where they belong, because we're not going to be able to staff 2 emergency rooms. Moving the patients out to the new site can be tricky if you're expecting and you know where you're to go. There are other patients who will be inpatients. That'll be a little bit easier because we know they're here, and we can make appropriate arrangements by ambulance to move people out to the new site. So those are just a few of the things. We need to make sure the ambulance people know where to go, and everyone else, whether it's the state hospital or the folks up at prison also well informed as to what's happening.
And Marty, you've announced that you're going to be retiring at the end of the year. And how do you feel? What's this feel like for you to have this event take place in this last year of your relationship with the Jamestown Hospital?
Actually, the fact that I'm still working is because of the employees and medical staff and board at the hospital. I had really planned to retire earlier, but once the employees and the medical staff and the board decided that we needed to replace our hospital, I decided I wanted to be on the train when it left the station and, be with all those grand people who have helped to make this the best job that I've had in my 40-year career, actually 43 years in healthcare. So that's why I'm still here, but I felt an obligation. Once you start something, you need to be with the people to finish, what we all started together and complete it. So, I think once it gets closer to the end of the year, I'll have all kinds of twangs of missing people and feeling, is this the right thing to do? But right now, there's so much to get done. Not only in regard to building the new hospital, but trying to get some of these new services here before the year's out. And clearly, neither the new hospital or getting these new services here is something that any one person can do by themselves. But still, you have an obligation to people who you respect and admire and a community that you've come to love.
Would you like to comment about what you'll be doing after you retire from the hospital?
Getting up late in the morning? No. Actually, I plan on working about 25% of the time. If there's enough people who are interested. It's a little bit early to do that, but some people have already approached me about working part-time. And the biggest thing is to, frankly, be visiting the grandkids and children that we don't get to see as often as we'd like. My wife and I would like to also go back to Africa for a longer stay than we did last year. So that's, a few of the things on the bucket list, as they say.
Well, let me just say, from perhaps representing the hospital, that we've all felt very fortunate to have worked with you over the past few years. I know you've been here about 8 years, 9 years. I've been here about a little over 3 years. And I just want to thank you for what you've done for the community of Jamestown and for the staff at the hospital.
What are some of the things that, as a patient at the new hospital facility, the Regional Medical Center, what am I going to notice is better or different at the new facility as opposed to the old facility?
I think once we're all comfortable with the new hospital, I think finding your way around the hospital will be easier. Even though the new hospital is only about 10,000 less square feet, it's much more compact. It's not as long. So you won't, if you're not feeling well, or you won't have to be walking as long distances. Everything will be much closer together on the ground, the main floor, I should say. You'll have all your diagnostic areas right next to the ER and next to the OR, and so getting you what you need will be a lot quicker. Certainly everything will be new and fresh and freshly painted, which is always a nice experience. I think we'll be able to treat patients in a more efficient and quicker way, simply because we'll have new tools to do that. We'll be able to track patients, better in the new hospital through the new systems. think you'll find that the staff who really get rave reviews for patient care, I think you'll find that they'll be able to spend even more time with you now because they won't have to be running long distances as existed, currently where we are. So those are the main things. I think you'll get even more attention than before, and I think it'll be a kinder building also for the staff who work here. And not just because it's pleasant, but I think it's just organized based on how care is delivered now as opposed to 75 years. Kennedy sent me a picture of the first x-ray done in the hospital, and that was done in 1950. So the building opened in 1935, but nobody really thought about, having an x-ray machine here. And actually 1950 was pretty early to have the first x-ray machine in any hospital, but it was in a patient room. It wasn't really set up for that. So, the founding fathers of this hospital did a great job in putting this building together, and as you look back at what they did, given what knowledge was available at the time, they really did a superb job. But technology just overtook the hospital.
It'd be nice for visitors too, isn't it?
I like to, just as you enter the hospital today, as you're coming in from the parking lot to the new hospital, as you go into the new Jamestown Regional Medical Center, you'll feel totally different. It has a very open, warm, healing atmosphere to it. And if you're a patient or if you're a family member and you're visiting a patient in a room, you'll notice the rooms are much larger than they are today. They're very, very comfortable. The view is pretty good, if you could call it a view from a patient room good. And as Marty mentioned, it's easy access by staff. So it's very impressive as you walk down that patient floor as to the space that's there, and it just feels good. I mean, it feels like you're going to be helped in the healing process.